A study released today by the Committee for a Responsible Federal Budget argues that health care reform should focus on reducing costs, including spending for Medicare and Medicaid. Joining us now is the president of the committee, Maya MacGuineas. Ms. MacGuineas, welcome to Bloomberg News.
Oh, thanks for having me.
Tell us a little bit more in detail what's in that report today.
Right. Well, we've been putting out a series of reports looking at health care reform really through the fiscal lens. When we've been talking about health care as a country recently, we've been focusing on two parts of it. One, controlling long-term costs, which is something we believe is really important. And two, expanding coverage through creating a new entitlement program, something that certainly is desirable to do, but has a very negative effect on the overall budget. So we're trying to focus back on the controlling cost piece, which really has to be the larger piece of this. And part of that has to be not just controlling costs for health care throughout the whole economy, but really looking at the government's bottom line in all of this.
Right.
How much we're spending on Medicare and Medicaid, some of the biggest programs in the budget.
And Ms. MacGuineas, I wanted to get into the entitlement programs in just a minute, but as you know, the president holding a town hall meeting on health care today in Virginia. What does your committee think of the president's proposal so far?
Well, again, the part that he's been emphasizing, how to control costs for the long term, something that we're very, very drawn to. The problem with controlling healthcare costs is we don't precisely know how to do it. And the administration has not kind of advertised this, but we're looking into different ways to control costs, looking at why some areas of the country spend less on health care than others.
Right.
But we don't yet know the answers. So we're very worried about getting out in front of those savings and using them to pay for new health care coverage rather than making sure that we really have this be as a down payment on reducing the very large budget deficit.
And those of you watching on Bloomberg television, you're looking at a live shot of President Obama speaking to that health care town hall meeting today in Virginia. Ms. MacGuineas, you mentioned Medicare and Medicaid, excuse me. Am I mistaken, or does it seem like they have not been a substantive part of the debate thus far?
Yeah, it's actually quite remarkable, isn't it, that they're some of the largest government programs. They're on an unsustainable path, and yet with this whole national dialogue about health care reform, you don't hear Medicare and Medicaid mentioned all that often. You hear coverage and you hear cost control, but we don't actually hear specific policies that would rope in the cost of Medicare and Medicaid. And we're going to have to go farther than just controlling health care costs. We need to do that.
Right.
Hopefully we'll figure out exactly how to do that, but we're going to have to do more and look at some specifics that affect those two big programs.
Well, does inclusion of a public option appeal to you?
You know, it's interesting. I feel like the public option has really become the lightning rod of this whole health care reform debate. We don't have a position on it. I think if it's done correctly, it could help bring in some savings in the private sector, but it very much concerns me that the way you get those savings is the government subsidizing a public plan too much. One, that costs the government money, and two, that's really unfair for competition if you believe in a level playing field, which is the right way to sort of spur efficiencies.
Well, can the United States afford health care reform right now?
We can afford health care savings, which is one part of reform. Less clear is whether we can afford a $1 trillion plan to expand coverage. If I were crafting this, I would say, let's figure out what's going to save the money in health care, put those things into place, whether it's comparative effectiveness or changing the way that we tax health care benefits, which right now isn't as efficient as it should be. Put those things in place, get those savings there, and then once the deficit is more manageable, talk about the extent to which we should subsidize expanding coverage, which is an important thing, but very costly.
Maya MacGuineas, the president of the Committee for a Responsible Federal Budget, joining us from Washington. Ms. MacGuineas, thanks.
Thank you.